Hello teachers, directors and colleagues, my name is Nicole Becerra.
A patient arrives at the emergency room with severe trauma symptomatology of number 1. Blurry vision, number 2. Fever, number 3. Edge pain, number 4. Droopy eyelids, number 5. Increased tearing, and number 6. Bleeding in the eye. The Dr. Zambrano reviews it and gives his diagnostic.
Hello, I am Dr. Zambrano and examinate picture Juan Felipe Sandoval. The orbital cavity has a quadrangular pyramid shape with measure approximated of height 35 mm, width 14 mm, and depth 45 mm. Orbital cavity is formed by an upper wall, a lower one, a medial one, a lateral one, and orbital vertex. In the superior wall we find the frontal bones. In the lateral wall, the sphenoid. In the inferior part we find the zygomate bones. The palatine and maxillary. In the medial side we find the ethmoid bone and also collar lagrimal. The orbital cavity is irrigated by the ophthalmic artery that is divided into two branches, which are the ophthalmic artery and infraorbital artery, which is venous drainage in chamber of the ophthalmic vein. How with the innervation to the orbital cavity is the optic nerve, the adduction nerve, and the nuclear nerve. With the review I was able to do, I was able to realize that the patient had no fractures of the orbital cavity, nor any nerve injury.
Blood tests were performed and the patient was found to be positive for human papillomavirus. The patient was referred to the ophthalmologist Laura Jimena Martinez.
Hi, I am ophthalmologist Laura Jimena Martinez, and taking into account the symptoms, I focus on the revision of the conjunctiva and related some pathologies such as bacterial or allergic conjunctivitis.
Since the conjunctiva is a transparent mucous membrane that lines the eyeball from the limbus to the bottom of the conjunctival sac, is the composed of the three conjunctival portions. They are the palpebral conjunctiva, the bulbar conjunctiva, and finally the bottom of conjunctival sac. The conjunctiva has the function of independent movement of the eyelid and eyeball. Is also provides the component of the their film, and one the most important in that film funds immunological function shows are the lymphatic drainage. It shows the clarifier that the conjunctiva is limited on the one hand wide the palpebral margin and on the other the sclerocorneal limbus. Irrigation is provided by the long anterior and posterior ciliary artery and by the palpebral arteries. And finally, innervation is given by one of the first ophthalmology division of the fifth cranial nerve.
Ordered a conjunctival soft culture, and the results were negative for conjunctival infections.
The choroides is the range of blood vessels and connective tissue between the width of the eyes and the retina at the back of the eyes. It is part of the uvea and provides nutrients to the urinate parts of the eyes. It is component by the cariopapillar, teleopigment, retina, blush membrane, stroma, superchoroides, and laminar fusca, and the sclera. Inner layer nerve tunica or retina, mid-red layer vascular tunic or uvea, out layer fibrous tunic or sclerocornea.
Good morning. This time we'll talk about the glass.
The retina is a thin membrane that covers a large part of the inner surface of the eyeball. It is sensitive to light. It is made up of photoreceptors canal. Rods and cones and neurons transmit electrical signals to the brain. The central retina contains the macula and the fovea. It is vascularized by the artery and the central vein of the retina. The retina is made up of a network of nerve cells that travel to the brain through the optic nerve. This makes them have a special anatomical distribution in the fonus. First, optic papilla. It is the head of the optic nerve where all the extensions of the neurons are grouped to carry the power to the brain. 2. Artery and vein of the retina. They are responsible for nourishing the innermost layers of the retina. 3. Macula. It is the area of the retina in charge of central vision, of the fine vision of the details of things, reading, trading, a needle. 4. Fovea. It is the center of vision, where the light rays that reach the retina are focused. 5. Peripheral retina. It is the one that allows us to have peripheral vision if someone is out of where are looking. The peripheral retina allows us to recognize it by its shape. 6. Vitreous. It is the gel that occupies the cavity of the eyeball. It is transparent and is attached to the retina. With age, it undergoes the aging process and is responsible for the flutter that some patients see. The retina is made up of thin, well-differentiated layers. They are intimately connected to transform the light signal they receive into the nerve impulse.
I performed a physical examination of the fascia and was able to show that they had a swelling and erythemosis in the upper eyelid of the right edge, and diagnosed her with an eyelid edema. Good morning. This time we'll talk about the glass.
Vitreous. The vitreous humor is the transparent gel that occupies the internal cavity of the edge, especially between the retina and the posterior face of the lens. This gel is composed mostly of water, collagen fibers, hyaluronic acid, and some cells, and all of this is surrounded by a membrane called hyaloids. Represent 18% of the volume of the edge, being the largest structure of this anatomy. This filling structure occupies 4/5 of the local volume of the eyeball and is made up of their parts. Hyaloids, also called the hyaloid membrane, it is a very thin membrane that surrounds the vitreous humor. This layer is divided into two, posterior and anterior hyaloids. Cortex. It is the peripheral zone of the vitreous humor. Its consistency is denser than in the rest of this ocular area. Central vitreous. As its name indicates, it is located in the center of the eyeball, and Its consistency is somewhat more liquid. Glass body lengths are in 10 5 mm, 13 years, 16 to 5 millimeters. Features keep the more or less spherical shape of the edge valid. Protect the different layers from possible trauma and make a uniform support.
Perform a basic age exam, which included a refractive evaluation and a health exam. An evaluation of the refraction allowed me to determine that I had vision problems, such as myopia.
Hi, good afternoon, everyone. My name is Mariana Galvis Garcia. I am a doctor of ophthalmology.
The iris. The most important function of the iris is to control amount of light that enters the eye through the pupil in order to facilitate the focusing of objects on the retina. They confront posterior long and short ciliary arteries, meet the anterior ciliary arteries, and form two circles. The major arterial, the minor arterial orbit veils. The internal carotid leaves ophthalmic arteria which, together with the optic nerve, enter through the optic foramen.
Hi, when observing the patient, I saw that the color of iris brown, and the pathologies that I could rule out were uveitis and iridocyclitis.
The crystal. The lens of late age is transparent structure of the cornea of the age. Anatomically, the lens will be located behind the vitreous humor and the iris. Sonula is superior ligament of the lens. It is a complete network of fibers, each of which measures approximately 7 to 8 mm in diameter. Crystalline function. Its main function is to allow objects located at different distances to be frozen correctly. Accommodation. Crystalline parts. The internal structure of the lens divides into two main areas: the innermost part of nucleus and the cortex, and the anterior superface of the cortex, which is covered by an epithelium with its tissue that can regenerate. External structure. Carnal bag. The lens is covered by transparent and electric layer. This part of the lens, which is like the skin of the lens of the eye or lens. Internal structure. Nucleus in the innermost area of the lens. The ophthalmologist Laura revisits the patient to rule out corneal edema. The cornea is a structure of the eye that allows light to pass from the outside to the inside of the eye and protects the iris and lens. It is composed of 6 layers: corneal epithelium, bone wands membrane, corneal stroma, dual layer, distal membrane, and posterior epithelium or corneal endothelium. Its function is that it acts as protective side for the eye, controls the focus and entry of light into the eye, and its innervation is given by ophthalmology division of the trigeminal nerve.
And taking into account the physical examination of the patient, and she was no present symptoms of corneal edema and was referring of the ophthalmology specialist Mariana Galvis.
The ile's muscle membrane veils located in front of the ile bulb, which can contact on with the other or separator. Function: main the integrate of the corneal surface, main the position of the eyeball, protect from eye particles. Anatomy: eyebrow, upper eyelid, edge of the orbit, superior orbital circles, integral angle of the eyelid, external angle of the eyelid, lower eyelid, ciliary border of the eyelids, Anatomical protection: skin, orbicles, orbital muscle, elevator muscle of upper aisle, medullary muscle, tarsal plate, tarsal conjunctive, the glands, meibomian glands, ciliary glands, small glands, basals and nerves, arteries, upper palpebral and lower palpebral, veins, ophthalmical vein and superficial temporal vein, nerves, sensitive, intratrochlear, lacrimal, medial, and lateral branch of the supraorbital nerves. Treatment of palpebral edema. Antibiotic treatment with oral amoxicillin 7 days.